Dr. Phillips' patient delivered her third child. The infant was born in a precipitous delivery. The resuscitation team determined that the infant is born at 39 weeks. When delivered, the baby boy is flaccid and is not breathing or crying. He is not breathing. You auscultate for a heartbeat and note that the heart rate is 56 beats per minute. You notice some acrocyanosis. The infant begins to have some gasping respirations. Another team member applies a pulse oximeter and a cardiac monitor. You begin positive pressure ventilation using a T-piece resuscitator. You begin to bag the term infant at 40 to 60 breaths per minute with an oxygen concentration of 21%. As you provide PPV for 15 seconds, you instruct the team to do a quick assessment of the newborn. 1. The most significant finding of successful resuscitation of this infant is A. Decrease in cyanosis, B. Increase in heart rate, C. Increase in oxygen saturation, D. Increase in the movement of extremities. Correct answer, B. An increase in heart rate after 15 seconds of PPV is a good indication of the success of lung inflation. The team member doing the assessment announces that the chest is rising and the heart rate has increased to 80 beats per minute. As the resuscitation team leader, you go through the Mr. SOPA interventions to improve ventilation and increase the heart rate. After an additional 15 seconds of PPV, the team reports that the infant's heart rate is now 102 beats per minute. Immediately after resuscitation, the team transports the newborn to the Neonatal Intensive Care Unit, NICU. 2. After transfer to the NICU, the team may do all of the following except A. Provide supplemental oxygen, B. Observe for complications of neonatal resuscitation, C. Continuous cardiac monitoring, D. Continuous epinephrine infusion. Correct answer, D. There's no indication that a continuous epinephrine infusion is required since the respiratory status improved with respiratory interventions alone. The NICU team begins close monitoring for complications associated with resuscitation. Respiratory system disorders that might result include pneumonia, pneumothorax, infection, aspiration, and pulmonary hypertension. 3. Possible respiratory interventions in the post-resuscitation period may include all of the following except A. Oxygen saturation monitoring, B. Positive pressure ventilation, C. Routine suctioning, D. Antibiotics. Correct answer, C. Routine suctioning is not advised in the post-resuscitation period since this intervention may decrease the baby's oxygen saturation. Instead, suction only is necessary. The team notes a drop in blood pressure that does not respond to fluid resuscitation. The NICU nurse calls a neonatologist who considers administration of positive inotropes. 4. If hypotension develops, the team may be required to administer positive inotropes. Inotropes A. Increase the contraction of the heart, B. Decrease cardiac output, C. Decrease calcium movement into heart muscle cells, D. Decrease central venous pressure. Correct answer, A. Increase the contraction strength of the heart. This will result in increased cardiac output and central venous pressure. Inotropes typically facilitate movement of calcium into heart muscle cells. The team providing post-resuscitation care monitors for neuromuscular problems, including seizures and hypoxic ischemic encephalopathy, HIE. 5. If HIE develops, the baby's post-resuscitation care may include all of the following except A. Anticonvulsant, B. Warming blanket, C. Intravenous feedings, D. Apnea monitor. Correct answer, B. Warming blanket. With HIE, hyperthermia can be a problem, so a warming blanket is not indicated. The provider may consider therapeutic hypothermia as a treatment modality. Poor feeding, seizures, and apnea would indicate a possible need for the other interventions. The team understands the endocrine disorders post-resuscitation are usually seen as metabolic acidosis due to electrolyte imbalances. 6. Electrolyte imbalances common during the post-resuscitation period include A. Hypoglycemia, B. Hypercalcemia, C. Hypernatremia, D. Hypokalemia. Correct answer, A. Hypoglycemia is the most common electrolyte disorder after resuscitation. Others include hypocalcemia, hyponatremia, and hyperkalemia. Treatment for these imbalances include close monitoring of electrolyte levels and replacement as needed.